Get her out of my face. Get me a real medic, or I'll walk out of this hospital myself. The voice boomed down the hallway of the VA Medical Center, terrifying the residents. Colonel Silas Graves wasn't just a patient. He was a war hero, a legend, and right now, a nightmare. He looked at the nurse assigned to him, a quiet woman with tired eyes, and saw nothing but a civilian who couldn't possibly understand his pain. He demanded she leave. He demanded someone else. He thought he was looking at a stranger. But when she reached for his IV line, her sleeve rode up, and on her forearm, amidst the pale skin, was a tattoo that made the colonel's blood run cold. It was a symbol he hadn't seen since the bloodiest days of the Koran Gul Valley. He thought he was fighting a nurse. He didn't realize he was yelling at the only soldier who had ever saved his life. This is the story of the tattoo that changed everything. The rain in Seattle didn't wash things clean. It just made everything gray. Inside St. Jude's Medical Center, specifically on the 4th floor, dedicated to high-risk veteran care, the atmosphere was stormier than the weather outside. Colonel Silas Graves was dying, though he would never admit it to anyone, least of all himself. At 62, Graves was a man carved from granite and scar tissue. He was a former battalion commander in the United States Marine Corps, a man who had led 300 men into the jaws of hell in Fallujah and brought most of them back. He was Ironhead Graves, but now he was just the angry old man in room 402 with a failing liver and a septic infection in his leg from an old shrapnel wound that refused to heal. I said no. The metal tray hit the floor with a deafening clang. 3 nurses stood in the hallway, looking terrified. The charge nurse, a sturdy woman named Brenda, rubbed her temples. He's at it again. That's the 3rd nurse he's kicked out this morning. He says the first one was too chatty. The second one smelled like vanilla. And the 3rd one, I don't even know what he said to the 3rd one, but he left in tears. Brenda looked down at the clipboard. We're running out of staff, people. Who's left? From the back of the nurse's station, a figure stood up. She was adjusting her scrubs, her movements precise and economic. Sarah Mitchell wasn't the type of nurse who stood out. She was 34 with dark hair, usually pulled back in a severe bun, and eyes that seemed to look right through you. She rarely socialized in the break room. She never talked about her weekend. She just did the work. I'll take him, Sarah said, her voice raspy. Sarah, honey, are you sure? Brenda asked, looking concerned. Colonel Graves is particular. He has a file as thick as a phone book. He's filed complaints against half the staff. He only respects authority, and even then, barely. I can handle authority, Sarah said. She picked up the fresh dressing kit and the tray of antibiotics. Does he need his morphine? He refuses to take it. Brenda sighed, says it dulls his senses. He's sitting in there with level 8 pain, just gritting his teeth. Sarah nodded. I'll see what I can do. As Sarah walked down the corridor, the linoleum squeaking softly under her sneakers, she checked the patient file one last time. Silas Graves, USMC Ret. Operation Phantom Fury. Operation Enduring Freedom. Silver Star. 2 Purple Hearts. She stopped at the door of room 402. She didn't knock. In her experience, men like Graves didn't appreciate the courtesy of a knock. They appreciated presence. She pushed the door open. The room was dim. The blinds were drawn tight against the grey afternoon. The smell of antiseptic and old sweat hung heavy in the air. Sitting on the edge of the bed, not lying down, was Silas Graves. He was shirtless, revealing a torso that looked like a road map of violence. Burn scars, bullet grazes, and the deep puckered crater on his right thigh where the sepsis was setting in. He looked up, his eyes like two chips of flint. "Who are you?" he growled. It wasn't a question. It was a challenge. "I'm Sarah. I'm your nurse for the night shift." "Sarah," he mocked, spitting the name out like a curse. "I don't need a Sarah. I need a doctor, or better yet, I need a corpsman who knows how to wrap a leg without cutting off the damn circulation. Get out." Sarah didn't move. She walked to the counter and set the tray down. "The doctor will be here in 2 hours for rounds. Until then, you have me. And your leg needs to be flushed, Colonel." "Don't you use that rank with me," Graves snapped. "You didn't earn the right to say it. You're just another civilian paycheck player. You think because you wear scrubs you know about pain. You know nothing." He leaned forward, the heart monitor spiking as his blood pressure rose. "I have been fighting this infection for 10 years. I have had better medical care in a muddy hole in Helmand Province from a 19-year-old kid named Private Miller using a dirty rag than I have had in this entire multi-million-dollar hotel you call a hospital. So do me a favor, Sarah. Get someone else. Get me a man. Get me someone strong enough to do what needs to be done." It was sexist. It was cruel. It was the lashing out of a man who felt his control slipping away. Most nurses would have walked out. Most would have reported him. Sarah just turned around, picked up a pair of shears, and looked him dead in the eye. "Private Miller," she said softly. "Miller was a good kid. From Ohio, right?" The room went silent. The only sound was the hiss of the oxygen tank in the corner. Graves narrowed his eyes. "How the hell do you know about Miller?" The air in the room shifted, becoming heavy and electric. Colonel Graves forgot his pain for a split second, his mind racing back to 2009 to a dusty outpost in the middle of nowhere. "I read your file, Colonel," Sarah lied. She kept her face impassive, a mask of professional detachment. "It mentions your history." Graves scoffed, the tension breaking, but the anger remaining. "My file, right. You read a piece of paper. You think reading a report tells you about the smell of burning diesel. You think it tells you what it's like to hold a kid's intestines in your hands while you wait for a bird that isn't coming." He winced, clutching his thigh. The infection was throbbing, a red-hot poker driving into his femur. "I'm not doing this with you." Graves grunted. "I want a new nurse. Now. I don't want a female. I don't want a civilian. I want someone who can handle this without fainting at the sight of necrotic tissue." "I don't faint," Sarah said, stepping closer to the bed. "Get out!" Graves roared, swiping his hand at the bedside table. A plastic pitcher of water went flying, splashing across the floor and soaking the hem of Sarah's scrub pants. The door to the room burst open. 2 orderlies and Brenda rushed in. "Colonel!" "That is enough," Brenda shouted. "Sarah, get out of there. We're calling security. We're going to sedate him." "No," Sarah said. Her voice wasn't loud, but it cut through the noise like a knife. She held up a hand to stop the orderlies. "No security. No sedation. He doesn't need to be drugged. He needs his dressing changed." "He just threw a pitcher at you," Brenda cried. "He missed," Sarah said calmly. She looked at Graves. He was breathing heavily, his face pale sweat beading on his forehead. He looked less like a warrior and more like a frightened, cornered animal. "Everyone out," Sarah ordered. "Sarah!" "I said out. Give me 5 minutes. If he hasn't calmed down, you can call security." Brenda hesitated, then signaled the orderlies to retreat. The door clicked shut, leaving Sarah and the colonel alone again. Graves looked at her confused. He expected her to run. He wanted her to run. If she ran, it proved he was right that nobody could handle him, that he was too broken for this world. "Why are you still here?" Graves whispered, his voice trembling with exhaustion. "Because your leg is rotting, Colonel. And if we don't clean it now, you're going to lose it. And a man like you doesn't deserve to lose a leg in a hospital bed. You deserve to walk out of here." She approached him again. This time, he didn't yell. He just watched her. She moved with a strange, heavy confidence. She didn't walk like a nurse. She walked with a low center of gravity, planting her feet firmly. "I'm going to cut the bandage," she said. "It's going to hurt. I'm not going to lie to you and tell you a little pinch. It's going to feel like fire." "I know what fire feels like," Graves gritted out. Sarah reached for the saline bottle. She began to soak the dried, crusty gauze that had adhered to the wound. Graves gripped the side rails of the bed, his knuckles turning white. He stared at the ceiling, refusing to make a sound. Sarah worked quickly. Her hands were steady. She didn't flinch at the smell of the infection, which was pungent and sweet in a sickening way. She peeled back the layers. "Talk to me," Sarah said suddenly. "What?" Graves gasped through gritted teeth. "Distract yourself. Talk to me. You mentioned Private Miller. Tell me about him." Graves shut his eyes tight. "Miller. He was my RTO, radio operator. Good kid. We were in the Arghandab River Valley. 2010. Not 2009. "My mistake," Sarah said, peeling the final layer. "We took fire from a tree line. Miller took a round to the neck. I tried to pack it. But the blood, it was too slippery." A single tear leaked out of the colonel's eye, tracking through the deep lines of his face. "I couldn't get a grip. He bled out on me. He was 19. He had a girlfriend named Becky back in Columbus." Sarah paused. Her hands hovered over the open wound. For a second, her professional mask slipped. A look of profound sorrow crossed her face, but she shook it off instantly. "He didn't die because of you, Colonel," she said softly. "You don't know that," he spat. "I do. A neck wound like that. Usually the carotid. You have 3 minutes. If the chopper isn't there in 3 minutes, God himself couldn't save him." She grabbed the forceps. "Okay, deep breath. I have to debride the dead tissue." Graves howled. It was a guttural, low sound. He thrashed his arm out blindly, grabbing onto Sarah's forearm to brace himself against the agony. His grip was iron tight, his fingernails digging into her skin. Sarah didn't pull away. She let him crush her arm while she worked on his leg with her other hand. She cleaned the wound, flushed it, and packed it with fresh alginate. Almost done, Silas. Breathe." She called him by his first name. He didn't correct her. Finally, she taped the new dressing down. "It's over. You did good." Graves fell back against the pillows, gasping for air. He released his grip on her arm. "Sorry," he wheezed. I grabbed you hard." "It's okay," Sarah said. She stood up and began to tidy the tray. She reached for the blood pressure cuff to check his vitals. As she reached across him, her scrub top shifted. The sleeve of her undershirt, which had been pushed up during the struggle, rode high on her bicep. Graves's eyes, groggy with pain, drifted to her arm. He saw the red marks where his fingers had dug in. But then he looked lower to the inside of her forearm. There was a tattoo there. It was old, The black ink slightly faded to blue, sitting stark against her pale skin. It wasn't a butterfly. It wasn't a flower. It was a skull. A skull wearing a shredded helmet superimposed over a pair of crossed Ka-bar knives. And underneath in jagged Gothic script was a set of numbers and a motto. 2/7, War Pigs. Valkyrie Graves stopped breathing. The room seemed to swoon. He knew that logo. He didn't just know it. He had designed it, 20 years ago, for the 2nd Battalion 7th Marines, the War Pigs, the unit he commanded during the bloodiest push into the city. But it was the word underneath that stopped his heart. Valkyrie. Nurse. Graves whispered, his voice trembling in a way the pain hadn't caused. Sarah was busy writing on the whiteboard. Yes, Colonel. Where? Where did you get that ink? Sarah froze. Her back was to him. She stood perfectly still for a count of 3. She slowly pulled her sleeve down, covering the skull. She turned around. Her eyes were no longer just tired. They were fierce. I got it in a shop in San Diego, she said dismissively, before I realized tattoos were a mistake. You're a liar, Graves rasped. He tried to sit up. That's a unit tattoo. 2/7, my unit. And Valkyrie, that was the call sign for the forward surgical team attached to us in Sector 4, the ones who came in when the medevacs couldn't land. He looked at her face, really looked at her. He stripped away the wrinkles of the last 10 years, the lack of sleep, the hospital lighting. He tried to picture her covered in dust, wearing a helmet, screaming over the sound of rotor blades. You're not Sarah, he whispered. I mean, you're not just Sarah. Sarah sighed. It was a sound of defeat. She walked to the door and clicked the lock shut. You need to rest, Colonel. Tell me, Graves shouted, finding his command voice. Who are you? She walked back to the bed. She rolled up her sleeve, exposing the ink again. She pointed to a small, jagged scar running through the skull's eye socket. You don't remember me, sir, and I didn't expect you to. I was wearing a balaclava and goggles most of the time, and you were usually unconscious. She leaned in close. I'm not the one who held Miller's intestines, Colonel. I'm the one who reached in and clamped your femoral artery when you took that shrapnel in Marjar. I'm the one who sat on your chest in the back of the Humvee and punched you in the face to keep you awake because you were trying to die on me. Graves stared at her, his mouth slightly open. Doc, he whispered. Doc Mitchell. They called me Stitch back then, she said with a sad smile. But yes, I was the Navy corpsman attached to your detail for Operation Phantom Fury. The realization hit Graves like a physical blow. The woman he had just verbally abused, the woman he had thrown a pitcher at, the woman he had dismissed as a weak civilian. She was Stitch, the legendary corpsman who had become a myth in his battalion, the one who had supposedly dragged 3 Marines out of a burning APC. He had spent 10 years thinking she was a ghost. I thought you died, Graves said. The convoy hit the IED en route Michigan. They told me everyone in the lead vehicle was KIA. Everyone else was... Sarah said, her voice dropping to a whisper. I was the only one who crawled out. The silence in room 402 was heavier than the lead vests used in X-ray. It was the silence of a graveyard. Colonel Silas Graves, a man who had stared down warlords and politicians alike, looked at the nurse standing by his bed and felt a crushing wave of shame. He had thrown water at her. He had called her weak. He had told her to get a real man. And she was Stitch, the woman who had become a myth in the battalion mess halls, The corpsman who had once performed a tracheotomy with a ballpoint pen and a pocket knife while taking mortar fire in Fallujah. Graves started, his voice cracking. He cleared his throat, trying to find the iron that usually coated his vocal cords, but it was gone. I didn't know. Sarah. Stitch. I didn't know. Sarah pulled her sleeve down, hiding the skull and the crossed knives. The fierce warrior faded, and the tired, overworked nurse returned. She slumped into the visitor's chair, something nurses were strictly forbidden to do. "Nobody knows, sir. That's the point," she said, staring at her hands. "Sarah Mitchell is a ghost. Stitch died in that Humvee in 2012. I made sure of it." Graves shifted the pain in his leg, now a dull throb compared to the ache in his chest. "Talk to me." The report said the IED was a daisy chain. 3 155mm shells buried under the asphalt. It said the lead vehicle was vaporized. "How are you sitting here?" Sarah closed her eyes. The hospital room melted away. Flashback, Kandahar province. 2012. The heat was physical. A heavy blanket that smelled of burning trash and goat dung. The convoy was moving slow, scanning for wires. Sarah was in the back seat of the lead MRAP, wedged between Corporal Tex Miller, no relation to the other Miller, and Sergeant Ruiz. They were joking about what they'd eat when they got back to base. Tex wanted a burger. Ruiz wanted to sleep for 3 days straight. Sarah was checking her med bag. She always checked it. It was a nervous tick. Then the world turned white. There was no sound at first, just a massive pressure wave that lifted the 14-ton vehicle like a child's toy and flipped it into the air. When the sound caught up, it was the sound of the earth splitting open. Sarah woke up in the dirt. Her ears were ringing so loud she thought she was underwater. The air was thick with black smoke and the copper taste of blood. She tried to stand, but her left leg wouldn't work. She crawled. She crawled toward the burning wreckage. She saw Ruiz. He was gone. She saw the driver. Gone. She found Tex. He was thrown 10 yards clear. She dragged herself to him, her medical training, taking over on autopilot. "Stay with me, Tex. Stay with me." But Tex was looking at the sky, his eyes glassy. "Tell my mom," he wheezed. Then the secondary explosion hit. A follow-up charge meant to kill the rescuers. It blew Sarah back into a ditch. She lay there covered in the dust of the road and the blood of her friends, listening to the enemy's small arms fire cracking over her head. When the QRF Quick Reaction Force finally arrived, they found her half buried, holding a pressure bandage on a man who had been dead for 20 minutes. Present day. St. Jude's Medical Center. Sarah opened her eyes. They were dry. She had run out of tears years ago. "I spent 6 months in a burn unit in Germany," Sarah said quietly. "Reconstructive surgery on my face and back. They fixed the outside. But inside I was done, Colonel. They offered me a medical discharge and I took it." "Why the name change?" "Why hide?" Graves asked gently. "Because they wanted to give me a medal." She spat, the bitterness sudden and sharp. "They wanted to pin a Navy cross on me for attempting to save the lives of my squad." "I didn't save them, Silas. I watched them die. I didn't want to be a hero. I didn't want the parades or the interviews or the thank you for your service. I wanted to disappear." She looked at him. "So I legally changed my name. I moved to Seattle where nobody knew the story of Route, Michigan. I became a nurse because because fixing people is the only thing I know how to do. But I swore I'd never wear a uniform again." Graves looked at the woman. He understood. He understood the guilt of the survivor. He had carried it for 40 years. "So why me?" Graves asked. "You saw my name on the roster. You could have swapped shifts. You could have avoided me. Why did you walk into this room, knowing I was the commander who sent that convoy out that day?" Sarah stood up. She walked to the window and looked out at the rain. "Because I heard you were dying," she said, her back to him. "I heard Ironhead Graves was letting a leg infection kill him because he was too stubborn to trust the doctors, and I thought, maybe if I can save the old man, maybe it makes up for Tex. Just a little bit." Graves felt a lump in his throat. He looked at his leg, the red streaks of sepsis climbing toward his hip. "I was ready to check out Stitch," he admitted. "I was tired. I figured I'd fought enough battles." Sarah turned around. The fire was back in her eyes. "Well, that's too damn bad, Colonel. Because you don't get permission to die. Not on my watch. You ordered us to hold the line in Fallujah. You ordered us to never leave a Marine behind. You don't get to leave yourself behind now." She walked back to the bed and pointed a finger at his chest. "I am going to save this leg, and I am going to save you. But you are going to listen to every word I say. You eat when I say eat. You take the damn morphine when I say take it. And you treat me like your corpsman, not your maid. Do we have an accord?" Graves looked at her. For the first time in months, he felt a spark of something he thought he had lost. "Fight." He snapped a sharp, crisp salute from his hospital bed. "Ura Doc," Graves said. "Ura," Sarah replied softly. The truce between Colonel Graves and Nurse Stitch Mitchell was forged in iron, but the war for his life was far from over. The real enemy wasn't the infection. It was the bureaucracy. The next morning brought sunlight, but it also brought Dr. Frederick Sterling. Dr. Sterling was the chief of surgery at St. Jude's. He was a man who looked like he was made of expensive skincare products and indifference. He walked into room 402 with a phalanx of residents trailing him like ducklings. He didn't look at Graves. He looked at the chart at the end of the bed. "Right," Sterling said, checking his gold watch. "Mr. Graves, septic shock markers are rising. White count is through the roof. The necrotic tissue in the right thigh is extensive." He snapped the chart shut and looked at Graves for the first time. "We're scheduling you for surgery at 1400 hours. We're going to amputate at the mid-thigh." The room went cold. "Excuse me," Graves said, his voice low and dangerous. "It's the only viable option," Sterling said breezily, already turning to leave. "The infection is deep. Attempting to salvage the limb would require aggressive debridement skin grafts and months of hyperbaric therapy with a low success rate. Amputation is clean, it's quick, and it gets you out of this bed in 3 weeks. "I am not losing my leg," Graves growled. "I came in here for treatment, not butchery." Sterling sighed, the sigh of a man dealing with an unruly toddler. "Mr. Graves, this is a VA-subsidized bed. We have protocols. We don't waste resources on lost causes. Your leg is dead. If we don't cut it off, you die. Sign the consent form or we discharge you against medical advice." Sterling nodded to a resident to hand over the clipboard and turned to walk out. "Dr. Sterling," the voice came from the corner. It was Sarah. She had been changing the IV bag silent until now. Sterling stopped and looked at her over his glasses. "Nurse Mitchell, is it? Do you have something to add?" Sarah stepped forward. She wasn't standing like a nurse anymore. She was standing with her feet apart, hands loose at her sides, a combat stance. "The patient has palpable pedal pulses," Sarah said clearly. "I checked them 10 minutes ago. He has sensation in the toes. The necrosis is limited to the fascia lata. It hasn't penetrated the muscle belly yet." Sterling scoffed. "And you know this how? Did you run an MRI with your X-ray vision?" "I know it because I probed the wound last night when I changed the dressing," Sarah said. "The infection is tracking along the scar tissue from his 2004 shrapnel injury. It's a pocket doctor, not systemic gangrene. If you perform a fasciotomy and install a wound vac, you can save the leg. Amputation is lazy medicine." The room went dead silent. The residents looked between the chief of surgery and the nurse, eyes wide with horror. Nurses did not speak to chiefs of surgery that way. Not ever. Sterling's face turned a shade of red that matched the colonel's infection. "Lazy," Sterling whispered. "You are a nurse. Your job is to change bedpans and follow orders. You do not diagnose. You do not suggest surgical procedures. And you certainly do not contradict me in front of my team." He turned to the charge nurse, Brenda, who was hovering in the doorway. "Brenda, get this woman out of my sight. I want her written up for insubordination, and I want her off this floor permanently." "No," Graves boomed. Graves tried to sit up, fighting the dizziness. "She stays. If she goes, I go. And if I go, I'm going straight to the press. I'm going to tell them that Saint Jude's prefers to chop up veterans rather than treat them because it's cheaper." Sterling narrowed his eyes. "You're bluffing. You're septic. You wouldn't make it to the parking lot." "Try me," Graves snarled. Sterling looked at Graves, then at Sarah. He saw the defiance in both of them. He was a bureaucrat, and bureaucrats fear one thing above all: bad PR. "Fine," Sterling said, his voice icy. "You want to play Dr. Nurse Mitchell, we'll do the fasciotomy. But I'm not doing it. I won't waste my hands on a procedure that is doomed to fail." He pointed at a terrified-looking young resident. "Dr. Evans will do it. He needs the practice." Sterling leaned in close to Sarah. "But know this. When the leg fails, and it will fail, and the infection spreads to his blood, his death is on you. And I will make sure you lose your license. I will make sure you never work in healthcare again. Not even walking a dog." "I'll take that bet," Sarah said without blinking. Sterling stormed out his entourage, scrambling to follow. When the door closed, the adrenaline crashed. Sarah leaned against the wall, her hands trembling slightly. "You just tanked your career for me," Graves said, staring at her with awe. "Why?" Sarah checked his vitals monitor. Her face was pale. "Because in the Korangal Valley, you carried me 2 miles on a broken ankle when the evac chopper couldn't land. You don't remember it because you had a concussion, but I remember. You didn't leave me behind, Silas. I'm not leaving you." Graves looked at the ceiling, fighting back tears. He had spent 10 years thinking the world had forgotten him. He had spent 10 years thinking his war was over, and that he was just debris left on the battlefield of life. But he was wrong. The war wasn't over. It had just moved to room 402. "Dr. Evans," Graves mused. "That kid looked like he was 12 years old." "He is," Sarah said, forcing a smile. "But he's got good hands. I've seen him stitch, and I'll be in the OR with him. You can do that?" "I'm going to scrub in," Sarah said. "Sterling thinks I'm just a nurse. He doesn't know I've done more field surgeries in the back of a shaking helicopter than he's done in his sterile theater." She checked her watch. "We have 4 hours until surgery. We need to get your strength up. I'm going to the cafeteria to get you something real to eat. No more Jell-O." Sarah opened the door to leave, but she stopped. She looked back at the colonel. "Silas," she said, her voice dropping. "There's something else. Something about Route Michigan I didn't tell you." Graves tensed. "What is it?" "The IED," she said, her expression darkening. "It wasn't random. We found out later. Intel suggested they knew we were coming. They knew exactly which vehicle was the command truck." Graves felt a chill that had nothing to do with his fever. "What are you saying?" "I'm saying someone sold us out," Sarah whispered, "and I think I saw the man who did it in the hospital lobby this morning." The revelation hung in the air, like smoke. Colonel Graves gripped the bed rail, his knuckles white. "The hospital lobby?" Graves demanded. "Who was it?" Sarah checked the hallway to ensure they were alone. "His name is Robert Eames. Back in 2012 he wasn't military. He was a private intelligence contractor working with the local warlords. He was the one who provided the route clearance intel for Route Michigan. He swore up and down that the sector was cold. We found out later he'd taken a payoff from the Taliban to steer a high-value convoy into the kill zone." Graves's face twisted in a snarl. "Eames. I remember the name. Intelligence Oversight denied everything. They said he was a ghost employee. He vanished 2 days after the bombing." "He didn't vanish," Sarah said, her voice shaking with suppressed rage. "He's downstairs. He's wearing a 3-piece suit." And he was shaking hands with Dr. Sterling. "Why is he here?" "I asked the desk clerk," Sarah said. "Robert Eames is the CEO of Aegis Medical Solutions. They're the new vendor supplying the hospital with prosthetics and surgical equipment." Graves laughed, a dry, bitter bark. "Of course. The man who blew our legs off is now getting paid millions to sell us the replacements. It's perfect." He looked at Sarah. "We handle him later. Right now, I have a war to fight in that operating room. You get me through this surgery stitch, then we go hunting." The operating room was a landscape of gleaming steel and blue drapes. The air was frigid. Dr. Evans, the young resident assigned to perform the fasciotomy, looked like he was about to vomit. His hands were shaking as he scrubbed in. Up in the viewing gallery, behind the thick glass, Dr. Sterling stood with his arms crossed, watching like a vulture waiting for a carcass. Sarah stood by the instrument tray. She wasn't just observing. She was scrubbing in as a surgical tech. "Dr. Evans," Sarah said, her voice low and steady. "Look at me." The young doctor looked up. His eyes were wide with panic. "I can't do this. Sterling is watching. If I mess up, my residency is over. The infection is too deep. Maybe Sterling is right. Maybe we should just amputate." "Stop," Sarah ordered. It wasn't a request. "You aren't fighting Sterling. You are fighting the enemy. The enemy is the bacteria. The territory is the leg. You are the commander here." She handed him the scalpel. "In the field, we don't think about careers. We think about the next 10 seconds. Make the first incision. I'm right here." Evans took a breath. He nodded. He lowered the blade. The surgery began. For the first hour, it was routine. Evans opened the compartments of the thigh, releasing the pressure. The smell was horrific, the rot of the infection. But Sarah didn't flinch. She anticipated every move, slapping instruments into Evans's hand before he even asked for them. Then the monitor screamed. "Bleeder!" the anesthesiologist shouted. "BP is dropping 80/50. Evans froze. A jet of dark blood was pulsing from the wound, obscuring the field. I nicked something. I can't see the source." "Suction. I need suction." The suction wasn't fast enough. The blood was filling the cavity. "It's the femoral branch," Evans stammered, backing away. It's compromised. I have to clamp the main artery. I have to amputate. Up in the gallery, Sterling picked up the intercom phone, a smug look on his face. Dr. Evans, terminate the procedure and proceed to amputation. Don't lose the patient. Evans looked defeated. He reached for the bone saw. No. Sarah barked. She stepped into the sterile field, violating protocol. She plunged her hand directly into the bloody wound. "Nurse, get back!" Evans shouted. "I have the bleeder," Sarah yelled. "I can feel it. It's a tear in the lateral circumflex. Evans, listen to me. I'm acting as a manual clamp. You don't need to amputate. You need to stitch around my fingers. I can't operate blindly around your hand. Yes, you can." Sarah stared into his eyes, her mask inches from his. "I did this in a ditch in Marjar, with a headlamp and no anesthesia. You are in a sterile OR. So the vessel. Trust me." Evans hesitated. He looked up at the gallery. Sterling was shouting into the intercom, but Sarah ignored it. She looked only at Evans. "Do it, Doctor. Save the Marine." Something in Evans changed. The fear evaporated, replaced by focus. He picked up the needle driver. "Don't move your fingers," Evans whispered. "I'm a statue," Sarah said. For 10 agonizing minutes, they worked in perfect sync. Sarah held the pulsing artery shut with her fingertips, while Evans sutured around her glove. It was a dance of absolute precision. "Okay," Evans breathed. "Releasing clamp. Now." Sarah slowly pulled her hand back. The bleeding had stopped. The vessel held. The monitor steadied. Beep, beep, beep. Evans slumped against the wall, sweat soaking his cap. "We got it. The leg is viable." Sarah looked up at the gallery. Dr. Sterling had put down the phone. He wasn't smiling anymore. He looked furious. He turned and stormed out of the observation deck. "Close him up, Doc," Sarah said, her voice trembling with exhaustion. "You did good." Recovery Room 4 was quiet. The rhythmic hiss of the ventilator was the only sound. Colonel Graves was still groggy from the anesthesia, but he was waking up. Sarah sat by his bed. She had changed out of her blood-soaked scrubs. She was exhausted, but her mind was racing. The surgery was a victory, but the war was escalating. Sterling wouldn't take this lying down. And Robert Eames was in the building. "Water," Graves rasped. Sarah held a straw to his lips. Slowly. "You still have the tube in your throat." Graves blinked, focusing. He looked down at the sheet covering his legs. He saw the outline of 2 feet. He let out a long, shuddering breath. "You did it." "Evans did it," Sarah corrected. "But I helped." Graves reached out and squeezed her hand. His grip was weak, but the intent was strong. "We need to talk about Eames." "I'm going to find him," Sarah said. "He's in the admin wing. I saw him head up to the executive suites on the 6th floor. "Sarah, be careful," Graves warned. "A man who sells out a convoy for cash. He won't hesitate to hurt a nurse." "I'm not a nurse today," Sarah said, standing up. "Today I'm 2/7." She walked out of the room. She didn't take the elevator. She took the stairs, moving silently. On the 6th floor, the atmosphere changed. The linoleum turned to carpet. The smell of antiseptic was replaced by the smell of fresh coffee and money. She found the office marked Hospital Administrator. The door was ajar. Inside, she heard voices. "The Graves situation is a problem, Robert," Dr. Sterling's voice said. "He was supposed to lose the leg. A crippled old man is easy to discharge to a nursing home. A recovering hero, he attracts attention. If he talks to the press about the equipment failures—" "Relax, Frederick." A smooth, oily voice replied. That was Eames. Nobody listens to angry old vets. We label him as suffering from PTSD-induced delirium. If he complains about the prosthetic quality, we say he's confused. Sarah stepped into the doorway. He's not confused, she said loudly. Both men jumped. Robert Eames was sitting on the edge of a mahogany desk. He was older than she remembered his hair, silver, his suit costing more than her annual salary. But the eyes were the same cold, calculating shark-like. "Excuse me," Sterling sputtered. "Nurse Mitchell, you are trespassing. I am calling security." "Put the phone down," Sarah said. She walked into the room and locked the door behind her. Eames looked her up and down, an amused smile playing on his lips. "Feisty. I like that. Who is this Frederick, one of your little helpers?" "She's a nuisance," Sterling spat. "She's the one who interfered in the Graves surgery." Eames chuckled. "Ah, the Florence Nightingale complex. Listen, sweetheart, you're out of your depth. Go back to changing bedpans." Sarah walked straight up to Eames. She stopped 2 feet from him. "Kandahar, Route, Michigan, October 12th, 2012. Eames's smile faltered. "What are you talking about?" "Sector 4. Sarah continued, her voice devoid of emotion. "You told Captain Miller the road was clear. You said you had eyes on the village. But you didn't. You met with the local warlord Al-Harik the night before. You took a bag of cash to route us into the ambush." Eames's face went pale. He stood up, towering over her. "I don't know what you're talking about. I was a consultant. Intel is never 100%. Tex Miller, Sergeant Ruiz, Corporal Davis, Private First Class O'Malley." Sarah recited the names like a prayer. "They burned to death in that MRAP because of you." Eames's eyes narrowed. He looked at her closely. He looked at the way she stood. He looked at the scar on her chin. "You," Eames whispered. "You're the corpsman. The girl. The one they found in the ditch." "I'm the one who lived," Sarah said. Eames laughed, but it was a nervous sound. "Well, isn't this a reunion? Look, honey, that was a long time ago. War is messy. Deals are made. It's just business." "Business?" Sarah's hand clenched into a fist at her side. "Yes, business," Eames snapped. "Just like this is business. St. Jude's needs to cut costs. My company provides cost-effective solutions. We save the hospital millions. If a few prosthetics crack, if a few wheelchairs break, that's the price of keeping the doors open. We are saving the system. You're killing people," Sarah said, "just like you killed my squad." Sterling stood up. "That is enough." "You are fired, Mitchell. Get out of this building before I have you arrested." Eames held up a hand. "No, wait. She knows too much, Frederick. We can't just fire her." Eames walked around the desk, opening a drawer. Sarah saw the glint of metal. It wasn't a gun. It was a letter opener. But he held it like a shiv. "You have no proof," Eames said softly. "It's your word against a respected CEO and a chief of surgery. Who are they going to believe, the hero nurse with a history of trauma? We can have you committed, Sarah. We can say you had a breakdown, attacked us." He took a step toward her. "You should have died in that ditch," Eames hissed. Sarah didn't flinch. She smiled, a cold, terrifying smile. "I did die in that ditch," she said. "That's why I'm not afraid of you." She pulled her phone out of her scrub pocket. The screen was glowing red. Recording 0412. Eames froze. He looked at the phone, then at Sarah. "I've been recording since I walked in," Sarah said. "The cloud sync is on. Colonel Graves has the file already, and he's friends with a very aggressive reporter at the Seattle Times. Eames lunged. It was a mistake. Sarah didn't brawl. She reacted. As Eames thrust the letter openers toward her, she sidestepped, grabbed his wrist, and used his own momentum against him. She twisted his arm behind his back with a sickening crack and slammed his face into the mahogany desk. "Ah!" Eames screamed. Sterling shrieked and cowered in the corner. Sarah leaned down, whispering into Eames's ear as she pinned him. "That was for Tex." The door burst open. Security guards rushed in, alerted by the noise. But behind them, leaning heavily on a pair of crutches, wearing a hospital gown and looking like the wrath of God, was Colonel Silas Graves. He had dragged himself out of bed. He had dragged himself up the stairs. "Don't touch her!" Graves roared at the guards. He looked at Eames, pinned to the desk. Officer Graves said to the security lead, pointing at Eames, "Call the police. I am Colonel Silas Graves, USMC, and I am placing this man under arrest for treason and conspiracy to commit murder." The arrest of Robert Eames and Dr. Frederick Sterling didn't happen quietly. It happened with the kind of noise that shakes institutions to their foundations. Colonel Graves, leaning heavily on his crutches, but standing taller than anyone else in the room, held the door open as the Seattle police led Eames away in handcuffs. The respected CEO was screaming about lawyers, about misunderstandings, about how he was a patriot, but nobody was listening. Sarah stood by the window watching the flashing lights below. She felt a strange lightness in her chest, a weight lifting that she hadn't realized she'd been carrying for 12 years. "It's over, Stitch," Graves said, limping over to her. "You got him. You got them all." Sarah turned. Her hands were shaking, the adrenaline finally crashing. "I broke his arm," she whispered, looking at her hands. "I didn't mean to. It just happened." Graves chuckled a warm, genuine sound. "Muscle memory, Doc. He's lucky you didn't break his neck." The fallout was swift. The recording Sarah made went viral within hours, thanks to Graves's contact at the Seattle Times. The story of the war pig colonel and the ghost corpsman who took down a corrupt medical contractor dominated the news cycle for weeks. The VA launched a massive investigation into Aegis Medical Solutions. Contracts were cancelled. Sterling lost his medical license. Eames was indicted on multiple counts of fraud and conspiracy. But for Sarah and Silas, the real victory was quieter. 6 months later. The rain had finally stopped in Seattle, replaced by a crisp, golden autumn afternoon. The VFW hall on 4th Street was packed. It wasn't a sad occasion. It was loud, raucous, and filled with the smell of barbecue and beer. It was the annual reunion of the 2nd Battalion 7th Marines. For 10 years, Colonel Graves had avoided these reunions. He felt he had failed his men. He felt he was too broken to lead them even in memory. But today the hall went silent as the double doors opened. Silas Graves walked in. He wasn't in a wheelchair. He wasn't on crutches. He was walking with a cane, a polished black stick with a silver eagle's head. But he was walking on his own 2 legs. The leg that doctor Sterling had wanted to cut off was scarred, stiff and aching, but it was there. "Atten hot!" a voice bellowed from the bar. The room of 200 Marines snapped to attention. The silence was absolute. Graves walked to the center of the room. He looked at the faces, some old, some young, all familiar. He cleared his throat. "At ease," he said, his voice cracking slightly. The room erupted. Men rushed forward to shake his hand, to clap him on the back, to welcome the old man home. But Graves held up a hand. "Wait. I didn't come alone." He turned back to the door. "Corpsman, up." Graves shouted. Sarah Mitchell walked in. She wasn't wearing scrubs. She was wearing a dress, but over her shoulder was a leather jacket. She looked terrified. Most of the men didn't recognize her at first. To them, Stitch was a legend, a ghost story, a face hidden behind ballistic goggles and a scarf. "Gentlemen," Graves announced, his voice booming. "You all know the story of Route, Michigan. You know we lost good men that day. But you also know the story of the corpsman who crawled through fire to drag our brothers out." He put an arm around Sarah's shoulder. "I found her. She's been hiding in plain sight, saving my life again, just like she saved yours." A murmur went through the crowd. A burly sergeant near the front, a man with an eye patch, stepped forward. He squinted at Sarah. "Stitch," he whispered. "Is that you?" Sarah looked at him. Tears welled in her eyes. "Hello, Sergeant Reyes. How's that shoulder?" Reyes dropped his beer. He enveloped her in a bear hug that lifted her off the ground. "She's alive," Reyes roared. "Stitch is alive!" The room exploded. Marines were crying, cheering, climbing over tables to get to her. They didn't see a nurse. They didn't see a civilian. They saw the guardian angel who had patched their wounds in the dirt. Later that night, as the celebration wound down, Graves and Sarah sat on the back porch of the VFW, watching the sunset. "You okay?" Graves asked. Sarah took a sip of her beer. She rolled up the sleeve of her jacket. She didn't hide the tattoo anymore. The skull, the knives, the Valkyrie. "I'm okay," she said. "Better than okay." Graves nodded. He tapped his cane on the deck. "You know, I was thinking," Graves said. "I'm retiring for real this time. Gonna buy a boat, but I need a medical officer, someone to keep me from doing anything stupid." Sarah laughed. "You want me to be your nurse on a boat?" "No," Graves said. He looked her in the eye. "I want you to be my friend. And maybe we can finally stop fighting the war, Sarah. Maybe we can just live." Sarah looked at the tattoo on her arm. She looked at the scar on his leg. "I'd like that, Silas," she said. She raised her bottle. "To Miller," she whispered. Graves raised his. "To Miller, and to the ones who made it back." They clinked bottles. Two warriors, battered and broken, but finally, truly home. Colonel Graves and Sarah Mitchell proved that the bonds forged in fire never truly break. They reminded us that sometimes the heroes we are looking for are right in front of us, disguised in scrubs or hiding behind scars. Sarah didn't just save a leg that day. She saved a soul, and in doing so, she healed her own. If this story moved you, if you believe that our veterans deserve the absolute best, and that we should never leave a brother or sister behind, please hit that like button. It helps us share these important stories with the world. And don't forget to subscribe and turn on notifications so you never miss a tale of courage, justice, and redemption. What do you think, was Sarah right to risk her career for the Colonel? Let me know in the comments below. Until next time, stay strong.